Okay, let's unpack this. You're walking your dog, everything seems fine, then suddenly, maybe after a little jump, they're holding up a leg, a painful limp that seems to come out of nowhere.
Right, and your first thought is probably, oh, it's just a strain, a minor injury.
Exactly. But have you ever considered it could be something far less common, yet much more serious, brewing inside that joint?
That's a really important thing to consider, and it's exactly what we're going to explore today. We're taking a deep dive into septic arthritis.
Ah, okay. Septic arthritis.
Yeah, this is primarily a condition affecting dogs, though our feline friends can occasionally be impacted as well.
Septic arthritis. It sounds
Mhm.
serious. In simple terms, what is it?
At its core, it's an infection within the space of a joint. This infection is caused by various pathogenic microorganisms, that's, bacteria, fungi, or other tiny invaders that manage to establish themselves in that normally sterile joint environment.
So, a microscopic invasion inside the joint. We've got some detailed medical information here from various texts outlining the definition, causes, all that. What's the crucial understanding from these sources about how this infection actually takes hold?
Well, the pathophysiology, which is just how the disease develops, pretty interesting and can happen in a few key ways. The most common is direct contamination.
Direct contamination, you mean like,
Think of a bite wound, yeah, or a puncture from a foreign object, maybe a sharp stick or something. Or even, unfortunately, as a rare complication from surgery, a joint tap arthrocentesis or maybe a joint injection.
ouch. So a seemingly minor injury could actually create an opening for a really serious infection deep inside.
Precisely. But that's not the only route. Microorganisms can also spread to the joint from an infection located, well, somewhere else entirely in the body.
Somewhere else, like what?
The texts we're looking at highlight primary infection sites like the urogenital system, the skin, including, chronic ear infections or even infected anal sacs, the respiratory system, the heart, even the GI tract sometimes.
Wow, so an infection that seems completely unrelated to their legs could end up causing a major joint issue. You wouldn't automatically make that connection, would you?
Not always, no. It's a key insight, really, that simple ear infection could potentially lead to a serious joint problem. It's a reminder these things can be interconnected.
Yeah, surprising ways.
Exactly. And in less frequent cases, the joint infection can even be a direct extension of a bone infection right next to it, which we call osteomyelitis.
Okay, so it's an infection within the joint space, and you said usually affecting just one joint, right? The sources use the term monoarticular.
That's correct. Monoarticular, meaning it primarily affects a single joint. While it could theoretically occur in multiple joints, it's far, far less common.
And how often do vets actually see this condition? Is it something owners should constantly worry about?
Our sources indicate that septic arthritis is relatively uncommon, thankfully. It's not the most frequent cause of that sudden single joint lameness we discussed, at least not in the general dog and cat population.
Okay, that's somewhat reassuring. Is there any link to specific locations? I saw mention of Lyme disease.
Yes, that's a crucial point. There may be a higher occurrence of septic arthritis in areas where Lyme disease is common, endemic areas.
Why is that?
Because the bacterium responsible for Lyme disease, Borrelia burgdorferi, it can sometimes lead to joint inflammation and, in some instances, might progress to actual septic arthritis.
Ah, I see. So in areas where lying is prevalent, a suddenly lame leg might raise suspicion for septic arthritis a bit more quickly.
Potentially, yes. It's something vets in those areas are certainly aware of.
Now, who tends to be more susceptible? Is this more of a dog problem or a cat problem?
It's definitely more of a dog problem. The information we have clearly states that it's most frequently seen in dogs and is actually quite rare in cats.
And are there particular breeds that seem more prone to it? Or is it across the board?
Well, any breed can be affected, but medium to large breeds appear to be more commonly diagnosed. The texts specifically mention German Shepherds, Dobermans, and Labrador Retrievers as being, well, more frequently affected.
Hmm, that's an interesting pattern. What about age? Is this something we see more in older pets, maybe with worn-out joints?
Actually, it can occur at any age, but the typical age of diagnosis tends to be sort of in that middle range, maybe 4 to 7 years old.
Oh, okay.
However, it's worth noting that when the infection spreads from another site in the body, that hematogenous spread, through the blood, it's more often seen in younger, immature animals.
Right, right. And finally, just covering the basics. Is there a difference between males and females?
Yes, the data suggests it's more commonly diagnosed in male dogs.
Okay, so a sudden single joint lameness in a middle-aged male, medium to large breed dog, possibly with a history of injury or maybe living in a Lyme-endemic region. That gives us a much clearer picture of who might be at higher risk.
It paints a picture, yeah.
Yeah.
Though remember, it can happen outside those parameters too.
Sure, sure. Now, how would an owner even begin to suspect something like septic arthritis? What are the key things they might actually observe at home?
The biggest warning sign, as we've already touched on, is the rapid onset of lameness affecting just one joint. And this lameness is usually quite pronounced, not just a slight limp.
Really noticeable. Okay.
Owners might also see visible swelling around the affected joint, and it will likely feel warm, maybe even hot, to the touch. And it'll be very painful if you try to gently move it or even touch it.
So not just a little bit sore, but genuinely causing significant pain. What about other clues?
Exactly. The sources also mention some historical clues that can point towards septic arthritis. This includes that history of sudden lameness, though. Sometimes it can develop more gradually, more chronically.
Okay.
Owners might also report their pet being unusually tired, lethargic, maybe having a decreased appetite. And as we discussed, there might be a known history of trauma or some kind of invasive procedure involving the joint, like a previous surgery or injection.
And what might a veterinarian find during a physical examination? What are they looking for?
Well, the physical exam will likely confirm that obvious lameness in a single joint, though, again, it's important to remember, in rare cases, it can affect more than one.
Right.
The vet will also be able to feel that pain and swelling in the joint upon examination, what we call palpation. Calming sites include the carpus, which is the wrist, the stifle or knee, the hock or ankle, and the shoulder or elbow joints.
So the major limb joints, basically.
Pretty much, yes. They'll also likely notice localized heat, a reduced range of motion in that joint, it just won't bend or flex as much, and potentially even swollen lymph nodes in the immediate area, the regional lymph nodes. Some animals may also have a fever.
Okay, so a very localized and, well, inflamed-looking and feeling joint. Now, we've talked about what it is and how it happens. Let's delve into who the common invaders are, the actual culprits, the bacteria, and other microorganisms behind this infection.
Right. The vast majority of the time, we're dealing with bacteria as the cause. Our sources categorize them into aerobic and anaerobic types.
Aerobic and anaerobic, meaning?
Aerobic bacteria need oxygen to thrive. Commonly found ones include Staphylococcus, Streptococcus E. coli, and Pastorella. Then we have anaerobic bacteria, which can survive without oxygen. Examples there are things like Propionibacterium, Peptostreptococcus, Fusobacterium, and Bacteroids.
Wow, quite the rogues gallery. So different types needing different conditions?
Exactly. And that's important because the lab needs to use specific culture methods for each type to make sure they can grow and be identified accurately.
Got it. And then there's the Lyme connection again you mentioned.
Yes, the Spirochete Borrelia burgdorferi, the bacterium that causes Lyme disease, is another bacterial culprit that can lead to septic arthritis. And mycoplasma is another type of bacteria that can sometimes be involved.
So mostly bacteria. But our sources also noted other possibilities,
Right.
less common ones.
That's correct. While less common, fungal agents like blastomyces, cryptococcus, and coccidioids can cause septic arthritis. Also, certain rickettsial organisms like Anaplasma, Ehrlichia, and Rickettsia, as well as Leishmania, and even, interestingly, feline calicivirus in cats have also been implicated.
So while bacteria are definitely the primary concern, it's a good reminder that other types of infections can also manifest in this way. It's not always straightforward.
Definitely not.
Now, are there specific factors that might make a pet more vulnerable, kind of predispose them to developing septic arthritis?
Absolutely. Our sources highlight several risk factors. A big one is any underlying condition that weakens the immune system or increases the risk of infection spreading through the bloodstream.
Like what sort of conditions?
Think conditions like diabetes mellitus, Addison's disease, which is hypoadrenocorticism, and any form of immunosuppression, maybe from medication like long-term steroids or other illnesses.
That makes perfect sense. A compromised immune system would definitely struggle to fight off invaders trying to set up shop in a joint.
Exactly. What else? Well, as we discussed earlier, any penetrating injury to a joint, including surgical procedures, directly introduces the risk of infection getting in.
Right, the direct contamination route.
Yep. Also, pets with pre-existing joint problems, maybe chronic osteoarthritis or other forms of joint damage, might be more susceptible. The joint environment is already a bit compromised.
Okay.
And finally, prior intra-articular injections, especially if steroids were administered into the joint previously, can also increase the risk. Steroids suppress the local immune response.
So it really seems like anything that compromises the normal protective barrier and environment of the joint can potentially create an opportunity for septic arthritis to develop.
That's a good way to put it.
Now, if a vet suspects this condition, how do they actually go about diagnosing it?
Yeah,
It's not like you could just look and see bacteria, right?
that's right. It requires investigation. The first critical step, as our sources emphasize, is to always consider septic arthritis when faced with a case of acute single-joint lameness. It absolutely needs to be on the differential diagnosis list.
So going back to our dog with the sudden limp, the vet wouldn't just assume it's a strain. They'd likely have septic arthritis in the back of their mind as a possibility right away.
A good vet would, yes, especially with those other signs like swelling and pain.
And what else needs to be ruled out? Because, a lame leg could have many different causes.
Precisely. The list of other possible conditions, the differentials, is quite extensive. It includes more common issues like just plain osteoarthritis flare-ups, trauma without infection like fractures or ligament tears, immune-mediated arthropathy where the body attacks its own joints, and even temporary joint inflammation that can sometimes occur after vaccination.
Okay, so quite a few mimics.
And there are also less common possibilities, such as specific conditions where greyhound polyarthritis, feline progressive polyarthritis, crystal-induced joint disease like gout, and even certain types of cancer involving the joint, like synovial sarcoma.
Wow. So a vet really has to be a bit of a detective to pinpoint the correct diagnosis.
Mm.
What about initial blood tests? Can those provide any helpful information like a high white count?
They can sometimes. Initial blood work, like a complete blood count or CBC, might show signs of inflammation in some instances, like maybe an increase in certain white blood cells, particularly neutrophils, maybe immature ones, what we call an inflammatory left shift.
Well, not always.
Quite often, actually, the initial blood work results can be completely normal or nonspecific, so it's definitely not always a reliable indicator on its own. You can't rule it out based on normal blood work.
Okay. What about more specialized lab tests, antibody tests or something?
Serologic testing can be beneficial, yeah, to look for evidence of specific pathogens, particularly if a tick-borne disease like Lyme or anaplasma is suspected based on the pet's location or, other clinical signs.
Right, connecting back to the Lyme prevalence. And what about imaging techniques like X-rays? Can those help visualize the infection itself?
Radiographs or X-rays can be useful, yes, but often not in the very early stages. Early on, they might only show subtle changes like thickened soft tissues around the joint, or maybe evidence of excess fluid accumulation within the joint space, joint effusion.
So nothing definitive early on.
The texts actually indicate that it's often difficult to definitively diagnose early septic arthritis based on radiographs alone. It takes time for bone changes to occur.
What kind of changes might you see later then?
In later stages, maybe after a week or more, you might see more significant changes like destruction of the bone surface under the cartilage, an irregular joint space, maybe bone spurs forming around the joint, and areas of bone loss or lysis.
So X-rays are maybe more helpful for assessing the extent of damage that has already occurred, rather than catching the infection right at the beginning.
That's a fair summary, yes.
Yeah.
They help assess severity and chronicity, but aren't great for that super early diagnosis.
So if blood tests and X-rays aren't always definitive early on, what is the real key? What's the crucial step to diagnosing septic arthritis accurately and quickly?
The crucial step, really the gold standard for diagnosis, is the analysis of the synovial fluid. That's the fluid inside the joint. And it's obtained through a joint tap, that procedure we mentioned earlier called arthrocentesis.
Okay, so they're actually extracting fluid directly from the affected joint. Sounds a bit uncomfortable.
It usually requires sedation or even general anesthesia, both for the animal's comfort and to ensure we get a sterile, uncontaminated sample. It's really important it's done cleanly.
Right. And what specific characteristics are they looking for in that fluid once they get it?
Several key things. In a joint affected by septic arthritis, you'll typically see an increased volume of fluid compared to normal. It will often appear cloudy or turbid rather than clear like normal joint fluid.
Okay, cloudy. What else?
The viscosity or thickness of the fluid will be reduced. It'll be more watery, and it will form a poor mucin clot, which is a simple bedside test that assesses the quality of the fluid's hyaluronic acid content in infection. That quality goes down.
Interesting. And then they examine it under a microscope, right? Cytology.
Exactly. Microscopic analysis, or cytology, is absolutely essential. A hallmark of septic arthritis is a significantly elevated white blood cell count in that fluid, typically exceeding 40,000 cells per cubic millimeter, sometimes much higher.
40,000. That's huge compared to normal, isn't it?
Oh, yes. Normal joint fluid has very few cells. And in septic arthritis, the vast majority of those cells, usually more than 80%, often over 90%, are neutrophils, those specific inflammatory white blood cells.
And what might those neutrophils look like under the microscope? Are they normal?
They often show degenerative changes, meaning they look damaged, their nucleus might be swollen or breaking apart, the cytoplasm might look abnormal, and the most definitive finding, the real smoking gun.
What's that?
Observing bacteria actually inside those neutrophils, phagocytized bacteria, that's a strong, direct indication of infection. Or even just seeing free bacteria present in the background of the synovial fluid sample.
Wow, seeing the invaders right there in action, that sounds pretty conclusive. But I know there's another critical step involving that fluid sample, isn't there?
Yes, absolutely. Synovial fluid culture is essential. While finding bacteria on microscopic examination can be a strong indicator, culturing the fluid allows us to hopefully grow and then identify the specific type of organism causing the infection.
And why is identifying the specific bug so important?
Because that allows us to do sensitivity testing, finding out exactly which antibiotics will be most effective at killing that specific bacterium. This is incredibly important for guiding treatment and ensuring we use the right drug.
Right, tailoring the treatment.
Mhm.
And that culturing process needs to be done with great care, I imagine, to avoid contamination.
Absolutely. As I mentioned, the joint tap must be performed using strict sterile techniques. The fluid sample is then typically placed in special culture media designed to support the growth of both aerobic and anaerobic bacteria, because we don't know which type it might be initially.
And you mentioned blood culture medium, too.
Yes, often some fluid is put into blood culture medium as well, because some organisms actually grow better in that specific environment. It can increase the chances of getting a positive culture.
It's interesting that blood culture media can be beneficial for growing bacteria from joint fluid. I wouldn't have thought of that.
Yeah, some research has shown that using a specific dilution of synovial fluid in blood culture media and incubating it for maybe 24 hours before doing the standard plating can significantly improve the bacterial recovery rate, sometimes by as much as 50%.
Wow, that's a big difference.
It can be. And for certain fussier organisms like mycoplasma or things called bacterial L forms or even protozoa, specialized culture procedures are necessary, so it's crucial for the veterinarian to communicate clearly with the diagnostic laboratory about what they suspect.
Good communication is key. What about other diagnostic tests? Our source mentioned synovial biopsy. Is that common?
Synovial biopsy, where a small tissue sample is taken from the lining of the joint, usually during surgery or arthroscopy, can be helpful sometimes, particularly maybe in ruling out immune-mediated joint diseases if the fluid analysis is ambiguous.
But for finding bacteria?
The information we have suggests that for actually growing bacterial organisms, it's generally no more effective than that incubated blood culture medium technique we just discussed. So it's not always necessary just for diagnosing infection.
Okay. And maybe blood and urine cultures, too.
Right. Those might also be performed if the veterinarian suspects that the joint infection has originated from the spread of bacteria from another site in the body, trying to find that primary source.
So really, the synovial fluid analysis, the cytology and the culture, those are truly the cornerstones of diagnosing septic arthritis.
Absolutely fundamental, yes.
Once the infection takes hold, what exactly is happening inside the joint that leads to all that pain, swelling, and ultimately the damage?
It's a cascade of damaging events. The synovium, which is the delicate lining of the joint capsule, becomes really inflamed. It gets thickened, often discolored, and sometimes grows excessively, becoming proliferative.
And under the microscope.
On a microscopic level, you see a huge influx of those inflammatory cells we talked about, the neutrophils, also macrophages, along with fibrin, which is like clotting material, sort of clogging things up within the synovial fluid and tissue.
And what about the cartilage? That vital cushioning tissue within the joint, that must take a hit.
Unfortunately, yes. The cartilage sustains significant damage. Enzymes released by the bacteria and the inflammatory cells start breaking it down. It begins to lose its protective layer of proteoglycans, which are essential for its structure and function.
So it loses its cushiony property.
Effectively, yes. The articular surface itself can be eroded, pitted, destroyed, and sometimes an abnormal tissue growth called pannus can form over the cartilage surface, further contributing to its breakdown.
So the infection isn't just hanging out. It's actively destroying the delicate essential structures within the joint. That sounds like it requires immediate, aggressive attention.
It absolutely does. Time is cartilage, as they say.
So what's a typical approach to treatment then? How do you fight this?
The initial treatment typically involves hospitalization. This is important for several reasons. It allows for stabilization of the animal if they're feeling really unwell, immediate commencement of broad-spectrum antibiotic therapy.
Broad spectrum meaning it covers many types of bacteria.
Exactly, while waiting for the results of the synovial fluid culture and sensitivity testing, which can take a few days. And, crucially, hospitalization allows for early efforts to drain and flush the infected joint to remove the bacteria, inflammatory cells, and damaging enzymes, trying to minimize further damage.
Like get the bad stuff out. And if they suspect it originated from another infection site, like that ear infection we talked about.
Then it's really crucial to try and identify and treat that underlying source of infection concurrently. You have to address the primary problem, too.
Makes sense. And after that initial phase in the hospital.
Once the initial crisis is managed and the pet is stable, the treatment transitions to outpatient care, which mainly involves long-term antibiotic management based on those culture results.
What about supportive care that owners can provide at home during recovery?
Applying alternating warm and cold packs can sometimes be beneficial. Warm packs can improve blood flow, cold packs can help reduce swelling and pain. Strict rest is also essential until the symptoms, the lameness, and pain fully subside. No running or jumping.
Okay, rest and maybe some comfort measures. Now, our sources mention surgical options. When are those typically deemed necessary?
It depends a bit on the stage. In acute cases where the X-ray changes are maybe minimal, the primary focus might be on joint drainage and lavage, essentially washing out the joint thoroughly.
How do they do that?
It can sometimes be achieved through repeated needle arthrocentesis, just tapping the joint multiple times to remove fluid and maybe instill some saline. Or, more commonly, either arthroscopically.
Using a small camera and instrument?
Exactly, a minimally invasive approach. Or through an open surgical procedure called arthrotomy, where they actually cut the joint open to clean it out. In some instances, especially in larger joints like the stifle or shoulder, an irrigation catheter system with an inflow and outflow tube might be placed to allow for repeated flushing over several days.
And for more advanced or chronic cases of septic arthritis, where maybe there's already significant damage.
In chronic disease, an open arthrotomy is often required. This allows the surgeon to actually surgically remove the thickened, diseased synovial tissue, a synovectomy, and to thoroughly lavage the joint under direct visualization. Again, post-operatively, those irrigation catheters might be used to continue flushing the joint for a period.
This joint lavage, the washing out process, sounds really important. Can you explain a bit more about what's involved? How do they do it?
Typically, large volumes of warmed, sterile saline or a similar balanced fluid like lactated Ringer's solution are used. They repeatedly flush the joint, letting the fluid flow in and then out until the fluid that comes out looks clear.
Just keep flushing.
Pretty much. It's critical, though, to avoid using antiseptics like povidone iodine or chlorhexidine directly within the joint during the lavage, as they can be irritating and damaging to the remaining cartilage cells.
Ah, okay. Just sterile fluid then.
Right. And if those catheters are left in place, the fluid being flushed out, the effluent, is often monitored daily. They might look at it under a microscope to assess the presence and characteristics of bacteria and those inflammatory cells, the neutrophils. Are they decreasing? Do they look healthier?
So you're tracking the progress of the cleaning.
Exactly. The irrigation catheters are usually removed when the effluent fluid appears clear of bacteria microscopically, and the neutrophils look cytologically healthy, meaning they look more normal, less degenerative. Arthroscopy, that camera technique, offers the advantage of allowing the surgeon to directly visualize the articular cartilage during the lavage procedure and is generally a less invasive method for achieving thorough joint flushing compared to a full open arthrotomy.
Right. Less invasive is usually better, if possible. Interestingly, though, our sources also pointed out that maybe surgery isn't always necessary, that medical management alone might be enough sometimes.
Yes, that's a really significant finding from some more recent research. It suggests that in certain cases, particularly maybe less severe or very early ones, aggressive medical management, meaning appropriate antibiotics based on culture, and perhaps repeated joint drainage via needle taps might achieve similar outcomes to combine medical and surgical approaches.
So just antibiotics and maybe some joint taps could work.
In some situations, potentially yes. It highlights that the approach might need to be tailored, and that our understanding of how best to treat this condition is still evolving. It's not always a one-size-fits-all surgical necessity anymore.
That's actually quite reassuring to know, as surgery is always a bigger deal, more invasive, more expensive.
Right. It offers hope for less invasive options in some cases.
Now, what about the choices of antibiotics? You mentioned starting broad spectrum.
Yes. While awaiting the results of the culture and sensitivity testing, the initial antibiotics chosen are typically broad spectrum and, importantly, bactericidal, meaning they actively kill bacteria rather than just inhibiting their growth. Common choices might be a first-generation cephalosporin, like cefazolin or cephalexin, or maybe amoxicillin combined with clavulanate.
And then once the culture results are back.
Once the specific organism is identified and its antibiotic susceptibilities are known, what drugs it's sensitive to the antibiotic therapy is then tailored specifically to target that bug.
What goes into choosing that specific antibiotic?
Several factors. Obviously, it needs to be effective against the identified bacteria. It needs to have acceptable toxicity or side effects. The practicality matters. How often does it need to be given? Can it be given orally or does it need injections? And of course, cost can also be a factor, especially for long treatment courses.
Do these antibiotics get into the joint fluid well?
Fortunately, yes. Most commonly used antibiotics do penetrate effectively into the synovial fluid, especially when the joint is inflamed, which helps get the drug to where the infection is.
And how long does the treatment usually last?
The total duration of antibiotic treatment is usually quite long. A minimum of 4 to 8 weeks is typical, sometimes even longer depending on the severity and response.
Wow, that's a commitment.
Yeah.
Are there any specific antibiotics to be particularly cautious about using in certain animals?
Yes, one important group is the fluoroquinolones, drugs like enrofloxacin. They should generally be avoided in young, growing animals, particularly puppies and kittens.
Why is that?
There's experimental evidence suggesting they can potentially induce cartilage damage in immature joints.
Uh,
So vets are usually very cautious about using them in growing animals unless absolutely necessary.
Good to know. What if the infection just doesn't seem to be responding to the initial antibiotic treatment? What's the next step?
That's a concern. Failure to respond well to conventional antibiotic therapy should raise suspicion for a few things. Maybe it's an anaerobic infection that wasn't covered well enough initially, or perhaps it wasn't grown on the initial culture. Or it could be one of those less common causes we mentioned.
Like fungal or?
Exactly. Fungal or spiraceae infections, like Lyme, which might require different and more specific treatment strategies, sometimes for even longer durations. So lack of response means rethinking the diagnosis or the treatment plan.
Okay, so continuous monitoring and potentially adjusting the treatment plan based on the response is really key. It's not just set and forget.
Absolutely not. Close monitoring is crucial.
Once treatment is underway, what does the recovery process typically look like? How long until things get back to normal?
Well, if those irrigation catheters were used during surgery, they might be removed after about 4 to 6 days. Or sometimes their removal is guided by repeat analysis of the synovial fluid, looking for those healthier cells and fewer bacteria.
And the antibiotics?
The antibiotic therapy, as we said, is long. It typically continues for at least 2 weeks after all clinical signs of infection. The lameness, swelling, pain, fever have completely resolved. So the total treatment course often ends up being 4 to 8 weeks or potentially even longer, depending on the specifics.
Okay, 2 weeks after they seem better. That's important. And even after the bacteria are definitely gone, confirmed clear, can there still be lingering issues within the joint? Does it just snap back to normal?
Not always, unfortunately. Persistent inflammation within the joint can occur even after the bacteria have been successfully eliminated.
Why would that happen?
It might be due to remaining bacterial components like bits of their cell walls that continue to trigger an inflammatory response, or it could be the body's own inflammatory cascade that just takes a while to settle down. It becomes almost like an immune reaction.
So what can be done about that lingering inflammation?
In such cases, after the infection is confirmed, to be cleared, you wouldn't want to do this if infection is still present. Sometimes systemic corticosteroid therapy might be considered cautiously to help reduce that residual inflammation. Along with that, a program of physical therapy is often really beneficial to help restore normal joint function, flexibility, and muscle strength.
Physical therapy for pets, right. And in terms of preventing future occurrences, especially if an animal has already had it once, is there anything specific that can be done?
The main thing is vigilance. If an animal has had septic arthritis and shows any signs of recurrence, that sudden lameness, swelling again, getting treatment started extremely early, ideally within the first 24 to 48 hours of noticing those recurring signs, provides the absolute greatest chance of a positive outcome in preventing severe relapse.
So jumping on it immediately if it looks like it's coming back.
Exactly. Don't wait and see.
What are some of the potential long-term complications if septic arthritis isn't treated effectively, or maybe if the diagnosis is significantly delayed? What are the risks?
Unfortunately, there can be significant long-term consequences. Chronic degenerative joint disease, which is basically osteoarthritis, is a very common sequel. The infection damages the cartilage and joint structures, leading to arthritis down the road.
Makes sense. Anything else?
There's also the risk of the infection coming back, recurrence. You might see a limited range of motion in the affected joint permanently, fibrous ankylosis where the joint gets stiff. In severe cases, there's a risk of the development of a widespread systemic infection, which we call sepsis.
That sounds life-threatening.
It can be, yes. And also the spread of infection directly to the adjacent bone, causing osteomyelitis, which is a bone infection and very difficult to treat.
Wow, those sound like very serious potential outcomes. It really underscores the need for prompt action. So putting it all together, what is the overall prognosis for a pet diagnosed with septic arthritis? Can they recover fully?
The prognosis is generally considered good if the disease is diagnosed and treated early and aggressively, ideally within that first 24 to 48 hours of onset. Early intervention makes a huge difference.
But if there's a delay,
However, if there's a significant delay in diagnosis, or if the infection is caused by bacteria that are particularly resistant to antibiotics, or are unusually aggressive pathogens, then the prognosis becomes much more guarded, potentially even poor, especially regarding full return to normal function.
okay, so the take-home message there is early recognition and prompt veterinary care are absolutely critical.
Couldn't stress that enough.
Right. So to summarize our deep dive today, what are the most important things we really want listeners to remember about septic arthritis?
I think the key takeaways are, first, septic arthritis is a serious infection within a joint that really necessitates swift diagnosis and aggressive treatment. Second, early recognition by owners of that sudden, often severe single joint lameness, especially when accompanied by visible swelling, heat, and obvious pain, should immediately raise suspicion and prompt a vet visit.
Don't ignore those signs.
Absolutely. Third, synovial fluid analysis looking at the joint fluid itself is the definitive tool for diagnosis. And finally, treatment involves a prolonged course of appropriate antibiotics, often lasting several weeks, and frequently includes procedures like joint drainage and flushing to clear out the infection.
So if you ever observe that sudden, painful lameness affecting just one of your pet's legs, maybe with that swelling or heat, it's absolutely crucial not to delay in seeking veterinary attention. Early intervention can make a massive difference in the final outcome.
Absolutely. Acting quickly is paramount.
It really is. And finally, just thinking about this, it really makes you consider how the body's own defense mechanisms, as complex and generally effective as they usually are, can sometimes be overwhelmed, leading to these localized but incredibly impactful infections like septic arthritis.
It's true that balance can be tipped.
Yeah, and it makes you wonder what other seemingly minor injuries or maybe unrelated illnesses could potentially have serious underlying consequences if they're not addressed promptly. It truly highlights that delicate balance of health and really the vital importance of just staying attentive, being vigilant about any changes we see in our pets.
Well said. Vigilance is key.